Okay, we're going to quickly go through nursing triage of COVID suspect or positive patients. So this is really for the nurses to be using to help them kind of risk stratify patients who are coming into the department. So the first thing for you to know is ideally you're going to do these triage assessments over the phone. So either the lobby phone in after hours or calling the patient on their cell phone during business hours. If you have to actually approach the patient, don't approach them until you're in your proper droplet PPE. The other thing to be reminded of is if this patient is presenting during the assessment center hours, Monday to Friday, 1:20 to 4, just go ahead and contact the family health team for an urgent appointment and send them over there. Okay. At the top here in this blue, I just have a reminder that anyone who is screening positive for potential COVID, who's presenting for diagnostic imaging or labs, they're going to be brought through the back door and into the back room to have their stuff completed in that area. And the reason we're doing that is really around safety and just making sure that everyone who's seeing these patients is wearing proper personal protective equipment. We are going to be working on maybe changing things up so that nursing, if you're already going to be in your PPE, might start drawing labs. We're not there yet, but just a little reminder. Okay, so now we're going to look at mild COVID. So for our purposes, we've kind of concluded that if someone only has mild symptoms, and those are listed there, so your muscle aches, fatigue, headache, sore throat, runny nose, diarrhea, nausea, loss of smell or taste, or if they only have one of the major symptoms. So major symptoms are new being really important, or worsening cough, shortness of breath, and fever. So if they only have those, one of the majors or mild, or just one major with no mild, and they don't have a significant comorbidity. So there was a really good article that was just published looking at what medical comorbidities increase risk in patients. And so these have been listed here in order of their risk associated with a negative outcome in COVID. So the top 4 being diabetes, chronic lung disease, cardiovascular disease, and anyone with an immunocompromised condition. So if they don't have any of that, we are going to classify them as mild. You're going to send the patient home and instruct them to self-isolate and monitor and book them an appointment at the respiratory assessment clinic. So on the desktop in Emerge, there's an icon for Marathon Family Health Team. You're going to click that and fill out the patient information to book an appointment, or you can call and leave a message. Okay? So that's our mild ones. Moderate. So again, just to clarify, this is really going to become important for people that are presenting after hours. If it's during the day, you can try to get all of these people in to see the assessment center, and we will be increasing the hours at the assessment center as we need to, okay? But after hours, if someone has these criteria, you probably should look at doing a set of vitals and reviewing the case with the physician. So 2 major symptoms, with or without minor symptoms, that's your new or worsening cough, shortness of breath, and fever. Presence of comorbidities, again, the ones higher on the list are more concerning. If their age is over 70, or if they report that they feel their symptoms are getting worse. Those would be reasons to consider bringing the patient in to the assessment room in the Emerge. So those COVID FRI rooms, we're going to be calling them assessment for now. And getting, your history, physical, and vitals done. And then reviewing the case with the MD on call, who's going to help you decide what to do with the patient and if they need anything more done. We also have an ER assessment of the COVID patient available that has like labs to consider and things like that if you're reviewing it with the physician on call. But that's kind of our moderate. And again, this is mainly going to come into play after hours, because during the day, you're likely going to be able to send these patients to the assessment center to have their assessment completed there. Okay. Over here, we just have the severe COVID. So this is any patient who is presenting in distress and their COVID status is unknown, or they've screened positive, or they're known to be positive. You're going to bring them to the COVID resuscitation room on the floor. So what used to be our OBS room is now our COVID resuscitation room. We need to kind of think about this as a secondary resuscitation room for patients who either have or are at risk of COVID. And the reason we're using that room is because we have negative pressure capabilities should this patient require any aerosolizing procedure, which would include CPR, high flow oxygen, bagging, intubation, anything like that. So think about it as a secondary trauma room, and that's where you're going to send anyone who is sick who potentially could need an intervention like CPR or an intubation or anything like that. And if you're not sure, it's okay to put them in this room. The room is has been set up in such a way that it's easier for us to clean. Okay, so that's your secondary resuscitation room. So I hope this helps. There's lots of kind of different permutations of all of these mild, moderate, severe, but the goal here is to kind of give you a starting place. But at the end of the day, you guys are amazing clinicians and fully capable of doing these assessments and really identifying sick and not sick, and so trust your instincts. Try not to get too bogged down in all the details, but that's what the triage is there for. Let me know if you have questions. I'm going to do my best not to change this anymore, but information's always changing. So have a good night.